Jamaica's public health system is being applauded for, quote, doing well, end quote, in its COVID-19 prevention and control programs. The praises come from the Pan American Health Organization's Assistant Director.
PAHO's Assistant Director, Dr. Jarvis Barbosa, says Jamaica's public health system has been highlighted by the organization for best practices in COVID-19 contact tracing and more.
Countries must prioritize contact tracing to limit the spread of the virus. Contact tracing must be part of all response plans and should be adjusted according to the pattern of transmission, from sporadic cases to cluster to community transmission. Argentina, Costa Rica, and Jamaica are just a few countries that are doing this particularly well.
He says surveillance data is the instruction manual that countries must use to detect rises in COVID-19 cases from urban to rural areas.
Effective surveillance systems allowed Chile to bounce back after unprecedented spikes earlier this year by tailoring its public health measures locality by locality. Thanks to strong laboratory surveillance systems, Caribbean countries have been disciplined about imposing restrictions and tightening public health measures when there have been new infections.
Dr. Barbosa says countries must rely on their primary public health care system as the foundation of their response to the pandemic.
Countries must prepare for the worst by having such medical teams on call for emergencies. Most countries across our region form emergency medical teams to provide the surge capacity when needed.
He notes that PAHO is not ranking countries on their performance in dealing with the virus, but is pointing to the best practices in specific protocols. For the news on PBCJ, I'm Simone Absalom.